Welcome back to the Deep Dive Learner. Today we are wading into a landscape that is just incredibly murky and, highly marketed.
Oh, and deeply personal, extremely personal.
Right, right. So I want you to just picture this. You've gone through childbirth, your body has fundamentally changed,
Yeah.
and you're dealing with, physical realities. Maybe it's structural laxity, maybe a loss of core strength, or just symptoms that are actively affecting your daily confidence.
Which is so common.
Exactly. So naturally, you're considering a medical or cosmetic procedure to restore your core or your pelvic floor.
Huh.
But there is this massive, lingering question just hanging over your head. What if you want another baby?
Yeah, it's the ultimate timing dilemma, really, because you want to feel like yourself again right now.
Right.
But you're staring down the barrel of investing time, money, physical recovery into this procedure that, well, a future pregnancy might just completely obliterate.
Exactly the problem. Okay, let's unpack this. Our mission today is to figure out if a future pregnancy actually undoes postpartum laxity treatments.
And it's complicated.
It is. And we're looking at a huge stack of sources today. Everything from like the glossy guides from cosmetic plastic surgery centers like Seattle Plastic Surgery and AKM Clinic to clinical FAQs from the Women's Health Clinic.
Plus the pregnancy seminar notes.
Yes. And the official safety overviews from NICE, which is the National Institute for Health and Care Excellence, because the narrative out there is just wild.
It's all over the place.
Right. So let's start with the heavy hitters, the structural interventions, the mommy makeover stuff.
Yeah, the surgical route.
Right. So when someone opts for a tummy tuck, an abdominoplasty, or, a vaginoplasty, what is actually happening under the hood there?
Well, we really have to look at this like structural engineering. I mean, an abdominoplasty isn't just about, removing excess skin for aesthetic reasons.
Right, it's deeper than that.
Exactly. The surgeon is physically going into the fascia, the connective tissue, and suturing the abdominal muscles back together to repair diastasis recti.
Okay.
So they are actively creating a rigid, tightened mechanical hold.
But then, you introduce a future pregnancy. You're putting a growing, rigid, multi-pound object right into that newly tightened space.
Yeah, it's a direct conflict.
And from what I'm seeing in the clinical sources, the mechanical strain is just catastrophic for those internal sutures.
Well, and it's worse than just mechanical strain because you also have to factor in the hormonal environment.
Oh, right.
When you get pregnant, your body floods with hormones, things like relaxin, which are specifically designed to soften ligaments and connective tissue.
Right, to prep for birth.
Exactly. So you have this medically engineered, sutured wall of muscle that's being biochemically softened while simultaneously being pushed outward by a growing uterus.
Ah.
So those internal sutures are under immense tension, and they can easily just pull completely through the softened fascia.
Which means the diastasis recti completely recurs.
Yes.
You're back to square one, but now you have internal scar tissue to deal with.
Which makes it even harder to fix the second time.
Right. And this exact same mechanical reality applies to the vaginal surgeries, right? Reconstructing the perineum or vaginoplasty for structural support.
Yeah, I mean, just think about the physics of a subsequent vaginal birth. You're forcing a baby, potentially a 4-kilogram baby, through the exact tissues that a surgeon just spent hours tightening, excising, and stitching back together.
Oh, man. I was actually looking at the pregnancy seminar notes on the major risk factors for pelvic floor trauma during delivery, and the math here is pretty daunting.
It really is.
Like if you're over 36, if you require a forceps delivery, or if you just have a really long pushing phase, your pelvic floor takes an absolute beating.
A massive beating.
Right. So pushing a baby through a surgically reconstructed perineum under those specific conditions sounds like a recipe for severe tearing.
It is. You're placing maximum physiological strain on tissues that have already lost their native elasticity.
Because of the scar tissue.
Exactly. The scarring from the previous surgery. Scar tissue does not stretch like virgin tissue does. It tears.
Wow. So if you're getting structural surgery before your family is complete, is it essentially kind of like renovating a house right before a hurricane hits?
Yes. Actually, I'd take it a step further. It's like renovating a house with rigid steel beams right before a hurricane hits, when you actually needed it to be built out of bamboo.
Oh, that's a great way to put it.
Right, because you've spent significant resources to build this beautifully finished, tight structure. But a pregnancy inherently demands expansion. It demands
It
flexibility.
has to stretch.
Exactly.
Yeah.
The physical forces of carrying and delivering a child will actively dismantle the rigid renovations you just made. And this is exactly why surgeons universally advise waiting on these structural surgeries until you are definitively done having children.
It makes complete sense when you frame it as this conflict between rigid engineering and dynamic biology.
Yeah.
But, this leads us to a really fascinating contradiction in the sources. Because if the hurricane is going to destroy the house anyway, the logical conclusion most people jump to is, well, I shouldn't do anything at all. I'll just live with the laxity, the urinary incontinence until I've had my last kid.
Which sounds logical, but the clinical consensus strongly argues against that.
Right. The Women's Health Clinic FAQ specifically debunks this. They say it's a total myth that there's no point in treating symptoms now if another pregnancy is possible.
Because there's a vital distinction here between structural surgical repair and conservative rehabilitation.
Okay, so when we say conservative care, we're mostly talking about targeted pelvic floor physiotherapy.
Yes, exactly.
And what struck me is this concept of recovery capacity. This idea that treating the symptoms now isn't a waste of time, even if you do get pregnant again.
Because conservative care isn't about creating a permanent static tightness, it's about building neuromuscular resilience.
Yeah.
When you do pelvic floor PT, you aren't just doing arbitrary Kegels. You are reestablishing the neural pathways between your brain and those specific muscle fibers.
Wait, but if the baby is just going to stretch those exact same muscles again during the next delivery, why spend months doing all those Kegels? Doesn't the hurricane still hit?
The hurricane definitely hits, but if we connect this to the bigger picture,
Okay.
you haven't built a rigid brick wall this time. You've planted a tree with deep roots that actually knows how to bend in the wind.
Oh, I see.
Right. A muscle that's been actively trained has dramatically better vascularization. That means better blood flow.
Better healing.
Exactly. And a higher density of recruited nerve fibers.
Meaning, when the strain of the next pregnancy happens, that healthy, trained muscle is physically more capable of stretching to accommodate the baby, and crucially, it's better at rebounding after the birth.
Precisely. Compare that to a muscle that was just ignored, allowed to atrophy, and then traumatized a second time.
Yeah, that makes sense.
By doing the physiotherapy now, you are literally expanding your body's biological capacity to recover later.
And the numbers from the Sydney Pelvic Clinic seminar notes totally back this up. It honestly blew my mind.
The statistics are wild.
Yeah. They show that pelvic floor muscle training reduces the rates of urinary incontinence in late pregnancy and postpartum by a massive 30%.
30% is huge.
And for stress urinary incontinence specifically, physiotherapy alone is an effective treatment in 80% of cases. 80%.
It is remarkably effective. But, we have to acknowledge the reality of human behavior here.
Sure.
Physiotherapy takes months. It requires daily, tedious, unglamorous effort. And surgery, on the other hand, requires massive downtime and is threatened by future pregnancies.
Right, so you have these two extremes, which basically creates an absolute gold rush for a middle ground.
Exactly. Enter the non-surgical quick fixes.
Yeah, and this is where the medical marketing gets so aggressive it's almost dizzying. If you're listening, you've probably seen the ads. Cosmetic clinics are heavily pushing energy-based devices.
Oh, everywhere.
We're talking about CO2 fractional lasers, erbium YAG lasers, and, radiofrequency treatments, things like Morpheus 8V, Forma V Votiva.
Right, because they promise the best of both worlds. They claim to rejuvenate, tighten, and restore function without the downtime of surgery and without the grueling daily effort of physical therapy.
So to understand what these devices can and actually cannot do, we really need to break down the mechanism of action. Because reading about it, it sounds a little bit like science fiction. How are they actually working?
So at a cellular level, these devices work by delivering controlled thermal energy, so heat, or by creating microscopic injuries to the vaginal mucosa.
They're essentially burning the tissue on a microscopic level to trick the body into healing itself.
That is precisely the mechanism. The goal is to trigger the body's natural inflammatory healing cascade.
Okay.
When the tissue registers this thermal injury, fibroblasts rush to the area to repair the damage. And this process stimulates the production of new collagen and elastin fibers, which increases local blood circulation and restores natural moisture.
But here is where we really need to draw a hard line. Because the AKM clinic documentation makes a very clear distinction.
It's a vital distinction.
Right. Energy devices can improve tissue quality. Like they can help with hydration, they can improve superficial elasticity, and they might help with mild laxity, but they absolutely cannot fix structural support.
And that is the defining limitation that constantly gets buried in the marketing.
Totally buried.
If you have a gaping vaginal opening or a torn perineal muscle from pushing out a baby, a laser cannot stitch that muscle back together.
Right.
It cannot restore lost anatomical architecture. It is literally biologically impossible for collagen induction to bridge a visible muscle tear.
So using a laser to fix a torn perineum is basically like trying to fix broken tent pole by ironing the fabric of the tent.
That's a brilliant way to visualize it. Yeah.
That makes the fabric look great, right? It's smooth, it feels rejuvenated.
Yeah.
But the second any real mechanical pressure is applied, the structure is still broken. The tent collapses.
Exactly. And worse, applying that iron too long can melt the fabric entirely, which is a whole other issue we need to get into.
Yeah, we definitely do. Because if you misidentify your problem, the solution will fail you. If your issue is vaginal dryness or mild stress incontinence caused by, tissue changes, lasers might genuinely help.
It might, yes.
But if your issue is mechanical structural failure from childbirth, a laser will never replace surgery or PT.
Never.
Okay, so let's pivot and look at the safety data, because the cosmetic sources make these lasers sound like a lunchtime procedure, just painless, quick recovery, basically a spa day for your pelvic floor.
Oh, the marketing is incredibly slick.
But when you look at the medical overviews from NICE, the National Institute for Health and Care Excellence, the adverse event reports sound like an absolute nightmare. Are women being sold a false sense of security here?
Well, this raises an important question, right? Because while many people do find relief, the aggressive marketing often downplays the reality that you are literally burning tissue to create scar-based collagen.
Right. Let's walk through some of these specific case studies from NICE, because the contrast with the marketing is just staggering.
It is sobering.
Case 1. A 65-year-old woman undergoes laser treatment. A few weeks later, she resumes intercourse and experiences heavy bleeding and 2 actual vaginal wall lacerations.
Wow.
And as she heals, she develops such severe fibrotic tissue that her vaginal canal foreshortened to just 2.5 centimeters.
And let's break down the cellular mechanism of why that happens, because it isn't just some random freak accident.
Right. It's physiological.
When you apply thermal energy, the intent is to create a mild injury that heals with flexible, healthy collagen. But if the energy settings are too high, or if the patient's individual inflammatory response just overreacts, the proteins in the tissue denature entirely.
They literally cook.
Yes. And when the tissue is burned beyond that therapeutic threshold, the body doesn't produce flexible collagen. It produces dense, rigid, fibrotic scar tissue.
Which doesn't stretch.
Exactly. Fibrosis lacks elastin. So as that massive internal scar heals, it contracts, literally pulling the walls of the vaginal canal inward and shortening it.
Which leads to a catastrophic loss of function. And we see this repeated in the other cases, like Case 2, a 68-year-old who developed a crescent-shaped fibrous band right in the middle of her vagina, creating a partial obstruction and a stricture.
Awful.
In Case 3, a 48-year-old woman who developed a complete transverse vaginal septum, a literal wall of scar tissue blocking the canal, reducing her vaginal length to just 2 to 3 centimeters.
And, the adverse reports don't even stop at strictures. You see severe burning, nerve damage, and drastically worsening dyspareunia, which is painful intercourse.
Which is incredibly dark when you realize these devices are explicitly marketed to improve sexual function.
Right.
And the result for these women was severe scarring and the complete inability to have intercourse.
Because when applied incorrectly, it destroys elasticity rather than restoring it. It highlights the real danger of commodifying a medical procedure. When you package a thermal ablation device as a cosmetic tweak, it strips away the clinical gravity of the intervention. You are intentionally traumatizing human tissue. The margin for error is narrow, and the consequences in that specific anatomical area are devastating.
It's a huge reality check.
Okay.
That is a sobering but entirely necessary image to keep in mind. So let's play this out to the end of the timeline.
Okay.
Let's say you're totally done having kids. You safely navigate all of this. You avoid the laser complications. You have successful structural surgery, or you crush your conservative physical therapy, and you get an incredible result.
Yeah, eel scenario.
Exactly. Are you finally fixed forever? Like, can you just check them off your list?
The short answer is absolutely not.
So basically, the pelvic floor is not a one-time project you can just check off a list.
Exactly. The human body is dynamic, and the pelvis is particularly vulnerable to the passage of time. The Women's Health Clinic FAQ directly answers this question. Can aging reverse successful vaginal laxity treatment? Yes.
Because even if we take future pregnancies completely off the table, we still have to deal with aging.
Right. Your risk of pelvic floor dysfunction naturally increases with age, regardless of how perfect your surgical repair was at 35. Because a prior good surgical result may just soften over time.
Oh, because the pelvis is continuously responding to mechanical loads.
And hormonal shifts.
Right, the hormonal shift. Data from the BMS Menopause Conference highlights this perfectly. During perimenopause and menopause, as estrogen levels drop, it's a massive destabilizer.
It really is.
The clinical data shows this estrogen drop leads to severe tissue fragility, dryness, and irritation.
Because estrogen is what maintains the thickness and resilience of the vaginal mucosa. When you lose that estrogen support, the tissue physically thins out, it becomes friable.
Wow.
So even if the underlying sutured muscle from a vaginoplasty is holding strong, the mucosal tissue covering it degrades.
Which means ongoing maintenance is just non-negotiable.
Absolutely.
And this applies just as heavily to the abdominal structural surgeries, too. The plastic surgery sources specifically note that while a tummy tuck permanently removes localized fat cells, gravity and lifestyle do not stop.
No, they don't.
To preserve the results of a mommy makeover, weight must be maintained within a 10 to 15-pound window. Forever.
Which is incredibly demanding. It proves that you cannot treat your body like a car engine where you just swap out a broken part and expect it to run perfectly for another 100,000 miles.
Right.
You cannot freeze human biology in time. Knowledge is most valuable when it's applied realistically.
Which brings us right back to conservative care.
Yes, maintenance is always required. It means adopting bowel-friendly habits, avoiding constipation and straining, which slowly dismantle pelvic floor support. It means continuing your pelvic floor exercises, and eventually actively managing that menopausal estrogen loss.
Okay, let's pull all of these threads together because we have covered a massive amount of ground today. If you are listening and you're mapping out your own postpartum recovery strategy, here is the distillation from the sources.
The key takeaways.
Exactly. First, will a future pregnancy undo structural surgical tightening, like tummy tucks and vaginoplasties? The answer is a resounding yes. The physical expansion of a baby and the hormones of pregnancy will subject those rigid repairs to catastrophic strain. So surgeons say wait until your family is complete.
But waiting for surgery does not mean accepting a state of dysfunction.
Right, because a future pregnancy does not undo the benefits of conservative physical therapy. Building that neuromuscular resilience, planting the tree with deep roots is something you can and should start immediately.
Regardless of whether you want more kids.
Exactly. And finally, if you find yourself tempted by the heavily marketed non-surgical laser treatments as an interim quick fix, you have to be hyper-aware of the clinical risks versus the cosmetic marketing.
They can improve superficial tissue quality, but they cannot reconstruct torn muscles.
And the risks of severe, permanent fibrotic scarring are very real.
Which leaves us with one final, broader thought to consider, building on everything we've looked at today.
Go for it.
We've seen that energy devices carry risks of severe strictures and denatured tissue. We've seen that incredibly expensive structural surgeries can easily be dismantled by a subsequent birth.
Right. The rigid house versus the hurricane.
Precisely. Yet we also saw incontrovertible data proving that simple, non-invasive pelvic floor physiotherapy can reduce urinary incontinence by 30% and build resilient recovery capacity.
Yeah.
So given all that, why is so much of postpartum care aggressively focused on expensive, risky aesthetic fixes? Shouldn't comprehensive, conservative pelvic floor physical therapy be a universal, mandatory standard of care for every pregnant woman long before anyone is allowed to hand them a laser or a scalpel?
That is a brilliant shift in perspective. It really highlights how upside down the priorities in postpartum care can be. Thank you for joining us on this deep dive, learner. Keep questioning the information you are fed. Demand to understand the mechanisms of your own body. And remember, don't start renovating the house with rigid steel beams until you are absolutely sure hurricane season is over.